So an undescended testicle is quite literally, as it sounds, it's a testicle which hasn't descended. Testicles begin life high up in the abdomen, near the kidneys actually, and slowly during fetal life, they descend through a combination of hormonal growth, abdominal pressure, and eventually work their way into the scrotum. And they can that movement can be stopped or can just stop at any point along that route. So testicles can be found when they're undescended, i.e. they're not in the scrotum, from anywhere between the groin and the abdomen. Obviously, the ones in the groin, we tend to be able to feel during the clinical examination, but if we can't, then we need to do other interventions such as keyhole surgery or laparoscopy so that we can detect whether there is a testicle there or not. Well, the truth is we don't really know what an actual specific cause, but as I explained, we know the reasons why testicles descend. We know it's a combination of hormonal, genetic factors, obviously being male, and having abdominal pressure. We know that's quite important, and sometimes exposure to excessive levels of estrogen for whatever reason are thought of as possible indicators. We do know risk factors, though, of being premature at birth. That's quite a well-known one for undescended testicles, because the usual processes of descent have been interrupted by the early birth. And genetics, probably in the fact that we know that there is a higher incidence in families. So if the father and the grandfather have always had undescended testes, then we do see that. Being born with a low birth weight is also a risk factor. So there's probably a combination of many of those which causes a testicle to arrest on that journey from the abdomen down into the scrotum. Again, there's been a lot of debate over that over the years, and the recommendations really international, certainly the European recommendations, are that most testicles should be placed into a scrotum before the age of 1, and certainly by the age of 18 months, so that we avoid any potential problems that the testicle, what the cells within the testicle need for their maturation and eventual sperm production. And I think most now in the UK certainly adhere to that, aiming to have the operation carried out by the age of 1. Sometimes that's not always possible, and parents certainly shouldn't panic if their testicle operation has not been done. But if a surgeon sees a patient early enough, then that can be planned, and that's the usual process in this country. With an undescended testicle itself, as opposed to the operation, so an undescended testicle, if it's within the abdomen, we know if that is not taken out of the abdomen, there is a higher risk of cancer later on in life. But the majority, and all men, need to be able to examine their testicles, which is in their scrotum. And if it's not in their scrotum, then it's not possible. But certainly when we are placing testicles down into the scrotum in early infancy, around the age of 1, the chances of cancer later on are much, much less. But of course, that is a risk for all men. And it's a very important part of why we do this operation, is so that men are able to feel their testicles. But also the function of the testicle. It's much more likely to function, be able to make hormones, be able to produce healthy sperm if it's in the right place, and being in the scrotum means that it's in a cooler environment and not inside the abdomen, hence it's going to work better.